EO.
Welcome to First Coast Connect. I'm Ann Schindler. Today, the State Department of Health slashes funding for HIV and AIDS care, how that change could leave patients at risk as soon as March 1st. Later in the program, an Afro-Caribbean artist explores themes of memory and the diaspora in her new St. Augustine exhibit. But first, advocates fear sweeping cuts to state AIDS funding could defeat the goal of keeping patients healthy, undetectable, and alive. Here to discuss it, we're joined by Dr. Mobeen Rathore, founding director of the University of Florida Center for HIV/AIDS Research, Education, and Service. Dr. Rathore, good morning.
Good morning. Thank you.
We're also joined by Justin Bell, advocate, CEO, and founder of Friends of the Quilt, and chair of the Northeast Florida World AIDS Day Committee. Justin, thank you for being here.
Good morning, and thank you for having us.
We're also joined by Cece Benson. She is a linkage to care specialist at the AIDS Healthcare Foundation. Good morning, Cece.
Good morning. Thank you for having me.
So, Cece, your organization provides medical care specifically for people living with HIV.
Yes.
How do you anticipate these changes will impact your patients?
So what I've seen, or what we have seen, have already started since the beginning of the year, is that everyone's frightened. You know, it's a state of shock. It's a state of fear. They don't know what's happening. They're either bouncing between, oh my God, I'm gonna lose my medicine, or, oh my God, I'm gonna lose my insurance and I can't get my medicine. Where does that leave me? I've even encountered some patients speaking about giving up hope. So it's a huge impact, a huge devastation where, we have to continue to say, hey, like we're going to work this through. You're going to get what you need regardless.
How have they mostly learned about this change? How were they notified?
So some patients were notified because they're watching the news. They tied into, what's going on. But then some patients, they're being notified by, I believe that we sent something out, just saying, hey, this is what's happening. And then a lot of patients also received mail, I guess the ones that were insured, saying that their coverage will end March 1st.
Justin, can you kind of walk us through some of the changes that are pending? We know that this was something that people mostly learned about in early January and takes effect, as I said, March 1. It's not a lot of time, but what are the changes? How do they impact people who are receiving Florida's AIDS Drug Assistance Program?
So, and let me first offer a small correction. And so I'm actually the former chair of the World AIDS Day Committee. What an honor to have served a few times as the chair of that committee. And it has led me to learn a little bit more about HIV advocacy and to bring me to a better place of where this conversation is today. So first of all, we have several thousand individuals within your listening area who will be impacted by this change. Many of them did receive a letter from the Florida Department of Health with this announcement and the change in policy. The way the policy happened at the level in Tallahassee was not the way that it should have been. There should have been a public hearing prior to this policy change. The next huge concerning factor is that you are correct. Currently, this change is expected to become effective March 1st, disenrolling many individuals because of the change in federal poverty level criteria that is set, the change in access to a frontline medication that many of our newly diagnosed individuals with HIV, and that's Biktarvy, coming off of the formulary. Super concerning for me. And the next, and I believe probably one of the biggest impacts, would be the dropping of the health insurance premium assistance. That is going to be super impactful. Many of our individuals aren't eligible for other programs. I myself was a beneficiary of ADAP, and ADAP assisted me with my premium. If I didn't have that assistance, I wouldn't be thriving in the community like I am today. I probably would be a little less accessible, a little less knowledgeable, and much less of an advocate for individuals with HIV. So going forward, should this thing actually become effective, and I'm hopeful that there is enough conversation around this change at the state level that there will at least be a delay so we can figure it out. There's not enough Ryan White funds within the state, let alone just our local Ryan White Part A, to be able to cover premiums, to be able to pay for this Biktarvy, to be able to fill that gap of individuals who are affected by the change in the federal poverty level. So we need more time to figure that out. We also need to include our elected officials at the state level, who I understand were quite shocked that they had no idea that this policy was done, and it's going to affect many of us. So as of March 1st, thousands of individuals in our listening area will either be totally ineligible for ADAP, that's how we know the acronym, the AIDS Drug Assistance Program. Thousands of individuals will be ineligible. Some eligible individuals who are eligible for ADAP who may be on Biktarvy, a frontline medication, 1 pill a day medication that has really pushed us through our mission for an area, a city, a state of no viral load. Now, we're not going to have access to that medication. Next is, of course, where do we go with this premium assistance? And as we know, we lost the federal support, and premiums for individuals, even at 400% federal poverty level, is already a challenge.
Yeah.
So those individuals will lose their health care.
Dr. Rathore, can you talk a little bit about big picture, where we are in terms of the challenges here in this area, historically, where we are now, and what your anticipation is if these funding cuts do, in fact, go into effect?
So I've been doing this for 35 years here in Jacksonville. This is probably the worst decision that has come through. And that's saying a lot. Why this drug was chosen, how the decision was made, what was the thought process, none of us know. We are guessing. It's going to impact many patients. Biktarvy is one of the drugs that's most often prescribed right now, not only in Jacksonville and Duval County, Northeast Florida, but throughout the state, throughout the country right now.
And remind us why this particular drug is useful and helpful for people.
It's once a day. People have lives, so taking. I remember when they had to take a palmful of drugs 4 times a day or 3 times a day, and I used to say one pill once a day would be ideal. And so I think
that's what this is. I mean, we used to call it a drug cocktail, right?
Right. So I think, I don't know. I think somebody sitting on a computer saw which drug costs the ADAP program most, and it's Biktarvy because it's used most often. It's not the most expensive drug,
and it takes the place of so many other drugs.
Exactly. And also, I think the adherence. You can give so many drugs which are very effective, but if patients can't take it, it means nothing. So Biktarvy has been. I mean, we at UF Cares in our center, we have 95% viral suppression. Now, once Biktarvy is not on the formulary anymore, there's going to be a problem. As was said, we are looking at this and see our patients who are going to be affected by that. What can we do for them? How can we help them? Yes, some of them can probably go to some other medication, not ideal, not best. Some will just not have a choice. Some we will be able to help through the patient assistance program. Hopefully, I'm hoping that Ryan White Part A through the city of Jackson would allocate some funds. But as Justin said, they're not going to be enough. Mm-hmm. So I think switching, Biktarvy is not the most expensive drug on ADAP formulary, but it's probably the one that's used most commonly, and so its costs are, and there's a good reason for that. Mm-hmm. I think it's short-sighted. That 95% viral suppression that we have reached is very important because it keeps patients out of the emergency departments, out of the hospitals, gives them, they can keep on going to work, they can be a productive member of the society.
I want to ask you about viral suppression too. I mean, if somebody has is effectively suppressed, I would presume that makes them less contagious as well.
Of course, they can less likely. I mean, it's not zero, but much less likely for transmission. I don't want any of your listeners to think that just because they are suppressed that they can't transmit it. I think this is something as a physician, I always have to remind people. So you can still transmit it, but it's much less likely. We know that, and so. But I think that's not yes. So they can give more infections if they're not suppressed. But think about these patients who are not going to get Biktarvy and may not be able to either immediately or in short run or long run not be able to get the medications. They're going to get sicker. They're going to show up on ERs. Somebody has to pay for it. If ultimately it's all of us. But that's why I mean it's short-sighted. It's a penny wise, pound foolish.
You don't think in the long term this will be a cost savings because of the trickle-down impacts of people getting sicker?
I don't think so. You're getting sicker. They're going to admit it. They won't be able to keep up their jobs. If you are an hourly wage worker and you can't go to work, not only you lose your income, but that business is going to have some loss also. This is a trickle-down effect that's going to impact. In my opinion, currently, other than trying to remove the vaccine requirements for school, this is probably the worst decision that has come from Tallahassee.
So one of the things that is changing, not just the formulary and what drugs are available, but also the aid for people to be able to either pay for insurance or offset some of those costs. And these pills that we're talking about, or some of these medications, as you mentioned, can be very expensive. Some patients will pay as much as $5,000 a month for their medications. But this new change in income eligibility is going to make people, for instance, there was an article written about a woman in Ocala who has an income of about $3,800 a month. Her medication costs her $5,000 a month. So there is literally no way that she'd be able to afford it, but she no longer meets those income guidelines. Is that something that you're seeing in your own clients, Cece?
Yes. I actually had a conversation with a case manager the other day, and she told me, she actually broke down the cost point, as far as, going from a 400 FPL to 130 FPL, that's
And
about 20,000.
The FPL being the federal poverty
Right,
level.
of course. So, when she said it to me, I'm like, 20,000 a year, like, how, like, no one can live off that regardless of a diagnosis, regardless of an illness.
And that's
So,
basically the new threshold for receiving aid through this program would be you'd have to make $20,000 a year or less as an individual
right,
in order to qualify.
right.
And
And
anything above that you would not.
right. So then, from, my point of view, is not, it impacts everybody, folks that are receiving Social Security to people that are just trying to make ends meet. And so, yeah, it's a very scary thing, and is hitting close to home, for a lot of patients. Even taking a look at myself, very privileged to even be able to have a job, be able to afford the medicine, and not even, to afford the insurance that pays for my medication. I'm very privileged within that space, but a lot of our patients are not.
If you're just joining us, we are talking about the impact of large cuts to the state's HIV/AIDS care programs. If you or someone you know is impacted, we'd love to hear from you. You can give us a call at 904-549-2937. You can also go to First Coast Connect to find all the ways you can connect with us. And of course, we welcome your calls and questions. We've got a call from Wells on the South Side. Good morning, Wells. Go ahead.
Good morning, Ann, and good morning to your guests. I just want to point out an observation on these cuts. These cuts are being made to cover the massive tax breaks that have been given to the wealthy. And people will die and people will suffer. And nothing has been done under this administration in the past year to improve the lives of Americans. And I don't hear many solutions coming from either party, the Republicans or the Democrats. So I would just like to put that in there about why people will be suffering. It's to make the wealthy wealthier. Thank you.
Thanks, Wells. We also have a call from Daryl in St. Augustine. Good morning, Daryl. Go ahead.
Hey, good morning, Ann, and good morning, all. Your guest there just made a very salient point that applies to not only this event, but also the entire health industry. Sick people are a liability to our community and to our country. Healthy people are an asset, and that's just purely economic terms. And that's sad, but that's it. So keeping these people healthy, they can keep working, they continue to pay taxes, they continue to buy things and stimulate our economy. If they're sick, they are a liability that us as a community and us as a country have to pay for. Unfortunately, with the privatization of and for-profit healthcare system we have, the health insurance industry and the hospitals make a profit from keeping people sick. And that's not what's done in every other country. And I find it abhorrent that people are profiting from the sick.
Daryl, thanks so much for your comments. Justin, I want to ask you, because the Florida Surgeon General, Joseph Ladapo, he told state senators in mid-January that rising costs stemmed from this year's expiration of subsidies for the American, the ACA.
Obamacare.
Yeah, forgetting what the acronym actually stands. Affordable Care Act.
Affordable Care Act.
So he's saying that this has yielded an enormous shortfall of $120 million or so, and that they need to ensure that they're putting the money where people need it the most and redirecting their resources. So he's made that presentation to state lawmakers, but you alluded to what you would like to see in terms of hearings. What would typically happen in a situation like this? It does seem like, you, as you say, there's not a lot of runway to prepare or for people to make changes to how they receive health care or find other funding sources.
First of all, I want to make it clear that I do not support this change at all. However, I will say that our Surgeon General is accurate with the change in the ACA and the premium assistance. That statement is truly accurate. I don't think that his representation or presentation to our elected officials provided enough information. Only because the conversations that I had last week in Tallahassee indicated that they were unfamiliar. This is across the aisle. Unfamiliar with what this policy change would do to over 16,000 individuals across the state. We've got to find funding. We have to advocate for it. It is there, and I believe that there should have been a different avenue that was taken, and that was to head into the our policymakers, the legislative session first. Take this to our state reps and senators first before we cut it here, and it's going to be really difficult and to pedal backwards if this change goes through.
I think the other important thing is this is, yes, we have subsidies have gone down, but states could have pushed. You know, we have senators here, we have Congress people. They could have, from Florida, pushed that those subsidies are not removed. So I think it's not, we have some responsibility for that. And I mean the collective way. The other point is we have to say that, oh, this is impacted because of that is true. But on the other hand, we also did not expand Medicaid. Had we had Medicaid expansion, some of these patients would not need some of these things.
And that's something the state has also refused to do.
And that was
for more than a decade.
Right. And that money was going to come in. That's additional funds that were going to come into the state. So we refused those. I think the challenge is, I feel like we are targeting the most vulnerable, most disenfranchised people in the state. Whether it's children not getting vaccines, and 12 cases of measles in Collier County, 5 cases of measles in Jacksonville, in Southwest Florida. 859 cases of measles in South Carolina. So here now we have these patients who are in Biktarvy, and majority of them, I hate to say this, we are not going to be able to find an alternate for them. And so as a result, what will happen? Their lives are going to be shattered. These are the people who have done so good in trying to keep themselves healthy. They've taken that responsibility to keep themselves healthy. And now we are saying, yeah, you did a good job, but I'm sorry, we're going to make you sick again. And we are making them sick. We are going to be responsible for every patient who is sick, ends up in the hospital, ends up, unfortunately, I hope not, gets a complication and passes away because of this. I mean, of course, I know Justin, CCI, and many others are looking at it, how we can make sure this does not happen. But it's not going to be easy. And I would be, I have to be honest, I think there are people who are not going to get what they need.
If you're just joining us, we were talking about significant cuts to the state's AIDS funding. If you'd like to join the conversation, give us a call on air at 904-549-2937. We have a call from Albert in Bay Meadows. Good morning, Albert. Go ahead.
Good morning. Thanks for having me on. First off, Doc, want to just say thank you for all that you do. HIV is near and dear to my heart. I had some people in my family, unfortunately, succumb to the virus. And then I have a couple of folks in my family who've been able to maintain on Biktarvy. My question is, with everything that's going on, it's going to be tough to fight, for the folks that are currently on Biktarvy. I just want to get your thoughts on people that could still possibly get infected, because this is something that's not going away. And when you can't suppress the viral load, then you make people more susceptible to transmitting it. Now, just want to get your thoughts. I know they talk about PrEP a lot, but are you familiar with the PEP pill in pocket method? Because as opposed to the PrEP every month, that would, and because they're cutting funding, if you use the PEP pill in pocket method, could that possibly help and kind of mitigate the cost that's decreasing, the cost that that we unfortunately won't be able to handle because they're cutting funds. But just want to get your thoughts on the PEP pill and pocket method, if you're familiar with that.
Thanks, Albert. And Doc, I'm going to ask you to explain what that is first.
Well, PEP pill and pocket is that PrEP is when you take the antiretroviral once a month or once a day, whatever you're on.
It's called PrEP.
PrEP, where there's pre-exposure prophylaxis. Before you get exposed to HIV, you're taking so it could be a discordant couple. One of the partners is HIV positive, the other one is not positive, so they can do that. The PEP in pocket is you can go with a pill, and when you have a sexual encounter, you take it. I think PrEP is much better. I would leave it at that. It's going to a long discussion. We don't have time for that. Maybe we can talk about it some other time. So does PEP has a role? Maybe in a very narrow some places, but I think in general PrEP is better. So, but I want to thank you, Albert, first of all, for your kind words, but we are not going away. We're going to fight this. I've been there in much worse situations when we had to stand up and say, you can't do this. I remember those days that we had to really stand up and fight, and it was ugly. As bad as this is, it's not like we were 30 years ago. But to get back to that, I talk about the post-vaccine era, because this is going to be post-HIV treatment era almost. I mean, we're going to, when in 96 the cocktail was first approved, we jumped up and down. Now you're saying, oh yeah, that was great, but we're not going to do it.
Justin, you've worked in advocacy for decades, both on policy matters and access. But this, to the doctor's point, is a community that has a long history of having to fight for healthcare. How does this announcement rank in terms of recent challenges on that front?
Oh, we are fighting. We are fighting. I think the community is stronger together, and I believe that just for you, having us on your program today is one other peg in there to get more of our fellow fighters. We need everyone at the table for this change. As Dr. Rathore has alluded to, this is the most negatively impactful policy that we have faced. With modern medicine, this should not be the case. We should be thriving. I wanted to quickly offer some clarification, and Albert, thank you for the call. If I could, and just I wanted to just let our listeners know that PrEP and PEP are actually not currently covered under ADAP. The medication that is covered under ADAP is specifically designated for individuals with HIV.
Okay. That's a good
So-
clarification. I want to ask you just kind of back to that previous question about the history here. There are also people, I think, in this state who feel that given this administration's sort of hostility to the LGBTQ community in terms of policies or, rollbacks on things that are being taught in schools or rights of certain individuals, that this is of a piece with that. Do you believe that this is in any way, what is the sentiment in the community about, this particular program being chosen for such drastic cuts?
That's a great question. And I truly believe that this is directly pointed at marginalized populations from the current administration. And if we're not seeing it here from the DeSantis administration, we will see it from the Trump administration. So the answer is yes. This is directly pointed to us, directly pointed to marginalized populations. LGBT, our Black, brown communities, our communities who live in impoverished environments. That's where this is showing up. And even though we're saying that you can be eligible if you make $20,000 a year, part of that program that you're eligible for has still removed some of the things that you need to remain in care, one of them being access to insurance.
And allow me to make 2 points. One is we're going to fight, but we rather collaborate. I don't think so. I want your listeners to leave this and think about, we want to collaborate. This can be done collaboratively.
How would you suggest a
Well,
collaboration?
Have some discussion. Okay, so you have sort of shortage of funds, right? We are all, forget about the reasons. We don't agree with the reasons, but we have shortage of funds. How do we use them best? It's not just, okay, let's just cut this out.
And so if they were going to reach out to the community or to the community of caregivers, physicians, what would you be saying to them?
Well, I'm not going to do the negotiations right here on the radio, but I think what we will tell them is we look at drugs for which we can have good alternatives. I don't want to talk about specific drugs because it impacts somebody else. But, we all have to, cut our cloth, for a quote that we have. So we have what we have. I'm not happy with what we have, but we can work on that. That's one thing. So we want to collaborate. We do not want to fight. The second part, the LGBTQ community may be targeted, but we forget the most people who are getting infected are heterosexual.
So let's talk a little bit about that, because it is worth noting that this is something that is often thought of as a disease of the LGBTQ community, and perhaps at one time it mostly was, but that's no longer the case, Cece. And so can you talk a little bit about just the patients that you're seeing and the infections that you're seeing and who your clientele is?
So, if you look at the statistics, it's, Black and brown communities for sure. And then, folks that are, that identify as LGBTQ. However, what I like to tell anyone and what I will shout from the mountaintop is that if you're engaging in sex, you are at risk. So, people have kids, people are married, so it's everybody's issue. It's everybody's disease. Our patients that we see, at AHF, young, old, in between, heterosexual, same sex, it doesn't matter. At this point, it doesn't matter. So, it's more of a, like, I like to push the narrative that, testing, and for those that have been or are living with HIV, to, take their medication. But now we're facing the issue where it may not be available. So then again, like I said, everybody's at risk.
So the other risk that we did not, and if I don't say this, I would not be true to myself. I'm a pediatrician. Pregnant women.
Yeah,
Yep,
I was going to
yep,
say,
yep.
when you talk about, an increase in your viral load, right now we've gotten pretty good at preventing it from spreading to newborns.
Yes.
But
Yes.
what is the situation there? What's needed to maintain that?
Well, so we have not had a single case of HIV infected newborn born to a pregnant HIV-infected pregnant women in our practice since 1998.
Wow.
Before that, it was about 25 babies every year. So we have been able to, quite a few babies have had a life without HIV infection. And in large part, we have been able to achieve because we can keep the HIV infection suppressed in the pregnant women. That's very important. We give them the perinatal protocols, but it starts with HIV being suppressed in pregnant women. And a lot of our women are on Biktarvy. And we will have to make choices here when we have limited funds. Who we give Biktarvy to? Do we give it to Mr. Jones or Miss Smith, who's pregnant or may become pregnant, where we can save perhaps 2 people? So I think these are choices we should not have to make. Right. It is in the richest country in the world, the best country in the world. Why do we have to make choices who lives and who dies, who is healthy and who's sick? We should not have to do that. We are all valuable people.
The progress that we have made in terms of people staying alive and living longer, Justin, is in fact one of the reasons that costs have gone up for all of these programs. It is a sign of success in many ways that it is getting more expensive to provide drugs because there are more people who are living longer and thriving with these drugs. So there is a kind of an inherent complexity to that reality that it's a sign of a healthy population when funds are getting more limited.
You are correct. So it has we have seen the increase in cost so that we can keep healthy people healthy. Mm-hmm. I want to say that I thought we were right at an intersection where I was on the mountaintop saying we need to eliminate the stigma because now we're finding more equal access to medication and care. This is going to take me down off that mountain, and where the priority message here, it's right now, is we need to be fighting like heck to keep this equal and fair access to medication and access to health care. This policy becomes effective March 1st. My messaging will change a little bit, but it does require us to change the subject when it comes to stigma, and to talk about stigma and be supportive of our individuals with HIV. And it starts also with our elected officials. It starts within the administration from Governor DeSantis and President Trump's administration to be more supportive. I wanted to offer a personal story for myself as an individual living with HIV. I hate using that term because if I weren't living, I would be deceased. I was almost there. And it was because of access to medication and healthcare. When Dr. Rathore first met me, I was in a wheelchair just coming out of hospice. While I identify as an individual from the LGBT community, my mode of transmission was actually a medical transmission. It doesn't have to be sexual. It doesn't have to be needle sharing. This policy needs to be stopped. I am hopeful there is a administrative law judge who is going to host a hearing on, I believe it's February 17th, and then offer a ruling. I'm not sure what that will look like after the ruling, but about a week later, he will offer a ruling on this.
And that's challenging this.
And that's challenging
pullback.
The policy. And I think mostly, though, Ann, is that they went about this policy the wrong way. Usually when the Florida Department of Health has a policy change, they have public hearings. That did not happen.
Mm-hmm.
Let me qualify one thing, Ann, because again, it's very important that your audience, your listeners know this. Yes, there is expense for taking care of the patients with HIV, but what we know is, we haven't done those studies recently because it's not necessary. Studies were done that showed that if people got treated, there's cost saving. It's actually, I think this is a little bit of it's hard to understand how can there be cost saving if hundreds and thousands of people are living longer. I mean, we have people in our practice who are 70s, almost 80s, and have been infected for 35. When I go to my clinic and one of my patients came in and gave me a big hug, and I was like, oh my God, I took care of you when you were born, because she's having a great life. She just, everything is working for her. But we know that it's more expensive not to treat or treat poorly, because even in the short period of time, if they don't survive too long, they a lot of expenses.
We're going to have to leave it there. Dr. Mobeen, Rathore, Justin Bell, Cece Benson, thank you all so much for what you're doing, and thanks for coming in today.
Thanks for having us.
Thank you for having us.
All right, up next, themes of home and migration emerge in a timely new exhibit in St. Augustine. Welcome back. An exhibit at the Crisp Ellert Art Museum in St. Augustine explores themes of home, displacement, and migration. The artist behind the show is Kendra Frohup. She is a 2025 Fulbright Scholar who received her Master of Fine Arts degree from Syracuse University. She's currently an Associate Professor of Art and Design at the University of Tampa, where she teaches sculpture and printmaking, and she joins us now. Kendra, thank you so much for being here. It's great to meet you.
Thanks for having me.
I'm going to have you scooch in just a little bit there.
Yeah.
Thank you.
Thanks for having me.
Yeah, it's a pleasure to have you. So this exhibit is called Roots, Return, and the Weight of Memory. And it reflects a little bit about your own story. Can you just tell us about your own experience and how it figures into the themes of the show?
Okay. Like you said before, I'm from the Bahamas. And so now that after post secondary education, I've spent most of my time in the U.S. And so a lot of my work is about memory. It's about my memory of living and growing up in the Bahamas. And I questioned that. And when I did my Fulbright, that's what led to this show. When I did my Fulbright, I revisited or did my Fulbright in the Bahamas. And so it gave me an opportunity to sort of reflect and create new memories and dig into the memories that I had as a child.
How do you think the art is impacted by just your experience, your migration experience, but also the travels that you've done? How does that figure into the work that you produce?
Travel is a big part of my art making. Travel allows me, one, to not only collect objects, but to collect processes. One of my colleagues the other day said, "You don't only collect objects, you collect, I'm a hoarder, really." So she said, "You don't only collect objects, but you also collect processes." And travel allows me to do that. My time in Africa allowed me to collect or learn bead making or paper making, etc. And so I find that enters into my artwork. So travel is a huge part of my art making, meeting people.
Do you try to meet other communities of artists when you're
Yes.
doing this traveling?
Yes. One of the most important things that I do when I travel is to go into the markets. And I think that's a place where you meet people in locals in their own element. And so that's when you find real experience, when you gather real experiences in the markets.
So your artwork, it's, part printmaking, part sculpture. You do casting in concrete and in metal, and then you also incorporate things that are from the natural world, even pieces of coconut, but
Right.
also kind of found objects. And there is a whimsy about it. And in fact, one of your shows, I believe, was
The Whimsical Collector.
that was at the National Gallery in the Bahamas.
Yeah, that was a 2022 mid-career retrospective. And so, yeah, I do, like I said, I'm a collector or a hoarder, however you want to title that. I collect objects, both natural, both industrial, and they find their way into my work. It's not always linear. When I say that, I mean it's not always a direct story, or they don't always connect to each other. Each work doesn't always connect to each other, but they somehow find their work. My nature is I'm whimsical.
What catches your eye when you're collecting or hoarding, as you say?
Familiarity is most important. I like things that I can relate to. Also, I think there is a sort of crude, rough quality that I look for. I like rust. I like worn, weathered, tattered.
Mhm.
I like to give it new life.
Mm.
And so that's something that I'm totally attracted to.
And is that something that's like a metaphor that you think about consciously, kind of giving something new life, or is it just sort of happenstance?
It's a little of both. I'm like I said, I'm from the Bahamas, and when I look at the culture, it's changing. And I take pictures often when I go. The nature of the buildings, they're not beautiful in the traditional sense, like the paint's peeling. There's a look, there's a quality.
Mhm.
They exist. They're functional, but not always beautiful to the layperson. So
Or not perfect?
not perfect. Yeah, perfect is the word.
Yeah. And I think of, collecting pieces and putting them together. There is a sort of childlike inspiration to that. I think it is something that kids are almost naturally drawn to create when they, pick up
Yes.
things and put them together. Did you start being an artist? I mean, you've probably
Yes.
always been an artist, but when did you start practicing it?
So I was reflecting on that the other day. I went back to my old neighborhood when I was on my Fulbright, and one of the things that I was in charge of, with my little group of friends, I grew up in this, I call it the hood. I grew up in Yellow Elder, and my with a close knit group of friends, and in playing dollhouse, I always constructed the house. Like I made it from pieces of wood laid on top of each other, and so I always had that sort of construction. My dad was a contractor. Construction slash whimsy and way of putting things together.
And so this exhibit, it goes through March 28th, but tomorrow you're having an opening reception and an artist walkthrough.
Yes.
What is it that you will anticipate that will look like?
So I anticipate people. The work is you can tell it's from the same artist. It's all cohesive, but it's different. Some of it's printmaking, like you said, some of it's sculpture, and I anticipate an audience that might be curious enough to question what I'm doing, how I got to it, my creative process, etc.
Well, the show is called Roots Return and the Weight of Memory by Tampa-based artist Kendra Froeup. It is at the Crisp Eller Art Museum at Flagler College. It's on view, as we said, through the 28th of March, and the opening reception is tomorrow. It starts at 5, but the artist walkthrough starts at 6. Kendra Froeup, thank you so much for being here today. Really appreciate it.
Thank you very much for having me.
Up next, the first ever La Villa Black History Market. We'll tell you what it includes and how you can attend this weekend.
Congaree & Penn, dedicated to agriculture and culinary endeavors, offering field-to-fork dining and outdoor experiences on over 300 acres. Sip, dine, explore. Information at congareeandpenn.com. Terrell Hogan Law.
I'm Wayne Hogan. Highway, hospital, home, work. Where injuries happen can make a difference in the law and the outcome.
More at terrellhoganlaw.com.
On the next Fresh Air, filmmaker Julia Loktev talks about her documentary, My Undesirable Friends, which follows young Russian journalists resisting Putin's regime before the invasion of Ukraine, and the impossible choices they face when dissent means prison or exile. Join us.
Today at noon on WJCT News 89.9. Elon Musk, Google co-founder Sergey Brin, and Wall Street billionaire Leon Black all identified as Epstein associates in the latest release of millions of documents from the Epstein files. Survivors and critics say it's only the beginning.
We won't be satisfied until we get the names of Jeffrey Epstein's co-conspirators and the names of the men who were protected.
That's on the next On Point.
Today at 11 on WJCT News 89.9.
Immigration enforcement is arresting a growing number of refugees and detaining them in Texas. It's a strategy immigration lawyers call a conveyor belt. The number of children in ICE detention has also grown sixfold under the Trump administration, with most held in Texas. The ICE detention budget grew by billions last year. What's the effect on refugees and children? Next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. Events honoring Black history are planned every week this month at a park inspired by what's commonly known as the Black National Anthem. Lift Every Voice and Sing Park kicks off the celebration with the first ever La Villa Black History Market. Here to talk about what's planned is Carla Michelle, curator at Lift Every Voice and Sing Park. Carla, welcome back.
Good morning.
We're also joined by Trey Ford, the curator of the La Villa Black History Market and the founder of the Florida Fish Pepper Company Growers Alliance. Hey, Trey, welcome back.
Hey, thank you.
And we're also joined by Tony Settles, event vendor and founder of the Well-Read Child. Good morning, Tony.
Good morning.
So I appreciate you all being here. Carly, you have events, as we said, slated for Black History Month, and this first one is on Saturday.
Yes.
So why is it that you're, well, tell us a little bit about the structure of it. I mean, there are going to be vendors, which I think would be expected, but you also have this series of guest speakers that you've invited, and they really run the gamut. First of all, tell us just kind of why you chose to structure it that way for this event, this first event.
We wanted our event to focus on storytelling. So we pulled in visual and oral elements of that. And it's actually something we wanted to do all of last year and thought it would be a good time to do it during Black History Month. So we're starting out with some performances, and then we move into a Looks of La Villa fashion show that's inspired by some of those old historic black and white photos that are in the Ritz Theater Archive. And then, and that's going to be curated by Folio Weekly Best of Jack's winner, Reek James.
Yeah, she won for the best
thrift store consignment. Yes.
Right on.
And she's a stylist. So we're so happy to have her vision with that. And then we have a Voices of the 904 segment that's currently at Channel 4, but we're bringing it to a live space at the park and interviewing some local change makers.
Okay. And these people are well known in the community.
Yes.
They include Dr. Rodney Hurst, who, of course, is the author of It Was Never About a Hot Dog and a Coke, and he was a very prominent civil rights activist. Carol Alexander, who's the historian and director of the A.L. Lewis Museum up in American Beach, but also Trey Lloyd Washington, who worked really hard for more than a decade to get this park built. So why is it important to include him in these conversations about Black history?
I think because, a lot of times the unsung heroes, the people who are behind the scenes, don't get the shine that they deserve. And they played an integral role in everything that we see on the scene or on camera as far as the arts that have been exhibited through the La Villa neighborhood and from Jacksonville, and obviously including the Johnson brothers. So it's just important to highlight that history, because if we don't highlight it, we don't get to absorb the benefits from it.
Yeah. And this, among the vendors that are going to be there, Tony, you'll be among them because you are an author and you also provide access to children through book fairs to stories that are reflective of their identity and their culture. And tell us a little bit about the books that you work to publish, that you have yourself published, and what people will be seeing at this event this weekend.
Oh, yes, absolutely. So I have curated a selection of books that amplify and uplift Black voices. They're culturally appropriate. They involve scenes that children can, identify with. I've also published a lot of books that are affirmative to Black children and just kind of uplift who they are.
Yeah.
And just to showcase and let them know that they, they belong in this world and they're seen in this world as well.
And you have a stack of some there for people who are watching on our live stream. Can you hold up one or two just to show and tell us what that one is about?
So this is a coloring book. It's not only a coloring book, but it affirms children of color, just to let them know that they're seen, they're loved, they're beautiful, and that they belong in the world.
Yeah. And Trey, in curating the event here, what are you going for in terms of just the dynamic of all of the participants and the balance of who is there to showcase Black history?
I feel like it's a very then and now type of curation. So we're going to definitely honor the past through the fashion show, especially with some of the styles that, were apparent in that time frame all the way up to now. So I think there's going to be a mixture there. Also just highlighting creativity and giving people another platform to create is really important. And so I see these events as a canvas where a lot of it we don't have to precondition. Just based on the people that we invite out, a vibe is created. And so I think that people should come out and enjoy also the melanin market that day with RAM. And so we expect people to be able to kind of go back and forth between both the two events.
Yeah, so we should say the Melanin Market, which is usually on A. Philip Randolph, is going to be partnering with RAM at the Riverside Arts Market location on that same day. So it's a place you can kind of bounce, as you say, between the two. Other than that, Carla, there's going to be some we mentioned vendors, but there's going to be like food trucks, face painting, other things people should know about.
Yes, and a taste of La Villa sampling. The vendors we've chosen who are reflective of the foods that came out of La Villa or that were there during its heyday, back when it was called Uptown.
Yeah.
And so, we encourage people to come out, vendors, food trucks, and it's free.
And a live painting of Eartha White by an artist here named Maya.
Oh, awesome. Okay. And we should say they continue these events. February 12th, there's Lift Every Voice and Sing Day, which is celebrating the first time that song was performed at the old Stanton School. February 21st, there's the Cookout. February 27th, Black Cinema History. So lots going on there. Carla, Trey, Tony, thanks so much for being here. Really appreciate it.
Thank you.
Thank you.
All right. Join us tomorrow when our Week in Review panel discusses the week's biggest headlines, from the mayor's vanishing hologram to the Duval parents detained by ICE as their children are at school. I'm Ann Schindler. You've been listening to First Coast Connect on WJCT News 89.9.
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.
The North Florida TPO is committed to shaping our transportation future. We're focused on planning, funding, clean fuels, and new technologies for a vibrant, connected community. Learn more at northfloridatpo.com. Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjacks.com. Clay Today is a multimedia publication offering Clay County residents information on news, sports, business, and community updates. More information and details at claytodayonline.com, Clay Today 904 on Instagram, and Clay Today Newspaper on Facebook.
This is WJCT News.